And welcome back. And we are moving into our second conversation for today as we're joined now by an all-male panel. Imagine that afterwards. So we're talking about the first annual National Testing Day. And this is, of course, to be able to reach a very important goal here in Belize. We have with us Arthur Usher on the end, who's the Communications and Programs Officer for the National AIDS Commission. In the middle, we have Eckert Middleton, who is the manager of the Health and Wellbeing Unit at the Department of Youth Services. And here we have Antonio Coyoc, who is the Monitoring and Evaluation Officer for the HIV program in the Ministry of Health. Good morning, gentlemen.
Good
and
morning.
thank you for being here.
Thank you for having me.
I hope you enjoyed our prior conversation.
Yes, it was
Okay.
good.
So we got that out of the way, right?
Yes.
Okay, good. So we're talking about a testing day that's being planned. And one of the things that I recognize is that this is our first National Testing Day. Tell us about why we decided to branch off and have our own Belizean designated day.
Well, the National Testing Day initiative is part of, well, it's a breaking down of a regional testing day initiative.
Yeah.
So for the past 7 years, Belize has been partaking in the Regional Testing Day initiative, which was sponsored by Scotiabank, and they pushed a 10-year program. As of last year, they completed their 10-year obligation. And so, not wanting to divert from the momentum of that program, the country on a whole decided, look, we needed to continue this program. It's very effective, and let's do it. So we located national sponsors. And they were more than willing, and they supported us, and so we're having our first National Testing Day.
Now, one of the things in timing it at this point in the year is to encourage people for the 6-month testing. So you have National AIDS Day on December 1st, and middle of the year you have what will now be National Testing Day. So people remember every 6 months you should get tested. Now, I have a question. In looking at the issue of HIV/AIDS, you know, I hate to say it, it's almost like it's not as dominant as it used to be. And it would lend one to believe that maybe it just isn't as much a problem as we once used to think. Is that the case?
The thing is, Marlene, as we keep saying on the shows, I think there's a lot of more health education going on. The message is being sent. So I guess by doing these tests on an every 6 months basis, people are actually coming out now. They're knowing the effectivity of the test as well.
Yeah.
So I think more it's geared now on myself knowing my status and going from there.
Yeah. And what are the number of new infections that we're looking at on a yearly basis?
On a yearly basis, it grows from 200 to 225. That's like the trend right now. 200
to 225?
Yeah.
Okay, and what are the yearly deaths?
The yearly deaths like approximately 100.
Okay.
Yeah. And I must add to that, those are just of people that are not on treatment. Late diagnosis and so forth.
Yeah.
Because the treatment is there, like as we keep saying on the shows, it's free of cost. Why not take it? You know.
Yeah, my next question, just in understanding the 3 dimensions: who's getting it, who's lost a battle to it, and then there's a more substantial number of people living and surviving with HIV. What are those numbers?
Basically. We go what we call a spectrum estimate. For example, right now, the country is estimated that there's approximately 4,265 persons living with the virus in Belize.
Okay.
From that, we have a total of a little over 2,000 that know their status. From that 2,000, we have approximately 1,500 that are actually on treatment. Right? So that's what we're trying to gear and working on to strengthen this process. And that's where the 90-90-90 comes in. So we're expecting that 90% of all persons that are HIV positive are going to know their status. From those 90% of persons that know their status, we're expecting that 90% of them are going to be placed on treatment. And from those 90 placed on treatment, we're expecting that they're going to achieve viral suppression. What do I mean by viral suppression?
Yeah.
We're expecting that these persons, the virus is going to be undetectable in their body. All right?
The problem that we're having, Arthur, is one of perception. That culturally, people want to stay as far, even if they have the virus, they want to stay as far from the conversation, far from associating themselves with it. And that permeates throughout the entire society. What in terms of the approach that the National AIDS Commission is taking to start the conversation, to connect with people, to get them past this huge cultural hurdle? And what different, in terms of what is happening internationally, how are we customizing it to start the communication in Belize?
Well, that's a very good question. And I think in terms of what we're doing at the Commission, in terms of localizing the response, is we're catering most of our ads based on Belizean concepts and Belizean situations. I know last year we launched the Wedding Conundrum ad, which spoke directly to some of the issues in a subtle kind of way, and if those who were picking up the ad saw the issue. We also designed an app for anyone ages 5 and up can play and get information. We're working on another app again for this year. But in terms of localizing the message and bringing across all these things, it's the same reason why we're doing National Testing Day. It's localizing the ad for this is a national viewed ad, and it's an ad that was designed nationally, went throughout the country to get these footage. And again, it speaks to everybody across the board, age ranges, economic background, all of that. How the country moves from here in terms of what we think and how we think culturally, behavior change is always a difficult process. And so we've been working at this for some years. What we've seen is that, I guess with every change, it's generational. So the younger generation is a bit more open to discuss and come in and talk about sexuality and talk about the disease and things like that. There is a gap, obviously, between then the previous generation and the generation before. So hopefully we can reach where we need to reach, given the level of
What's our
awareness.
vulnerable age population right now?
I would say anywhere between 15 to 49.
Can I ask
Enter
this?
Eckert.
Yeah, that's
Enter Eckert. But we got to bring you in a conversation. Eckert. You work with young people through the youth department.
Yeah.
What are the barriers to the type of behavioral change that all these entities have been working towards? Why are they still engaging in risky behaviors? Condoms are free, cheap, accessible,
Education is
widespread.
Right.
Yeah.
What do you hear?
The only issue that usually comes up with young people and condoms is that it's not as good as doing it bareback, meaning without using a condom. The whole process of enjoying sex is one of the things that they reflect on a lot, is that the condoms itself that is provided is one of the ways that we're looking at it. It's an idea of getting them familiar with it and comfortable with using a condom. But their sentiment, and they're constantly telling us that it's not as good.
Yeah.
They don't want to use a condom because they don't have the feeling, skin on skin type of feeling. And the other part of that would be where they could use testing as a way of prevention. Usually, if they are sexually active with multiple partners, you'd use a condom. The idea is to get them to that mindset of using a condom if you have different sexual partners.
Yeah.
So
You know, this seems to be, and I really feel that sometimes maybe the risks associated with unprotected sex perhaps isn't as widely communicated, or there's some kind of disconnect. Because, let me give you an example. I understand, and we've been hearing it for many, many, many years, that, people feel that using a condom somehow leads to some kind of desensitization and sex isn't as enjoyable. But there are many things we do for our health that are not enjoyable. Let's start with exercise, but you want the results.
Yeah.
Or you know the risks of not doing it.
Yeah.
I may take a medication that tastes horrible, but I want to feel better. Or, if it's folic acid, when you're pregnant, you know the results, So there are things we do that we don't like because there's a result that we want. Right. So how do we get people to realize that, okay, you jeopardize, and it depends, of course, on the type and brands, because technology does so much now. You jeopardize just a little bit, or you give up just a little bit for what is a better health result. What would you say to people? What do you tell your boys, your girls when they come in and they say that?
Exactly that. That reducing their risk requires that they use a condom. But at the same time, there are other underlying issues for them, especially when it comes to condom negotiation. A lot of the times, it's not up to the person who is, it could be either male or female, so I don't want to make it a gender issue. And it's usually the person in power that would decide whether or not you'll use a condom. And that's where the issues are. And if you want to protect yourself and your partner doesn't, then that conversation doesn't even happen. And for young people, it will become even harder if their partner is much older than them. They would have the advantage of discouraging them from using a condom and using all sort of methods to do that.
Can I peel back a little? The composition of the National AIDS Commission. What is the average age of the commission? Who's the youngest on it?
Youngest entity?
The youngest representative.
Dominique Morales.
Dominique Morales.
The
And
youth
he is the
department.
she is the
youth. She's a youth rep.
President of the Youth Council.
Yeah.
I asked that because my question was, is the approach that we're taking, we have a at-risk group.
Yeah.
And it seems that 90% of the persons planning are in fact persons outside of this group.
Age range?
Outside of that age range. Even in terms of this initiative, I don't know, and we're going to get into dynamics later of, where is it going to be and how you're going to access it, but does there need to be a radical shift away from the old people making these decisions and more focusing on empowering the youth to in fact take the reins and say, listen, somebody who's 70, 80 who wants to create a pamphlet and spend $50,000 of UNICEF money or government's money is a waste when I can take that same thing, create an ad on Facebook for free and boost it for $10 US and I get far more coverage. Are we having the wrong persons at the rein, and is it not time to have a more radical, popular approach to it? To solving the issue? Well, either one.
Go to first.
What happens is that this information I'm sharing is actually coming from young people. Our office is a mixture of old and young. Ms. Dominique Morales, she sits with us at the IEC committee.
The Communications Committee,
Communications Committee. We discuss these issues, but we go with what young people are saying in terms of how to engage them in preventative methods, workshops, training, and even forums. When it comes to their participation, it's more of them being on the front end, working with other young people as peers. Our role basically is to guide them with certain things when it comes to the intervention. Because even though it's a youth perspective, there are certain things that would require us to guide that process so that financially it is a sound, So the partnership is more of listening to where they're coming from, what the needs are, and then figure out how we could do that at a national level.
The other thing I wanted
to... Which is exactly what we did in May this year and last year, November. We held 2 youth forums. The first with in-school youth and the second with out-of-school youth. And the idea was to gain their perspective on data and how they see HIV, and then how to, they gave us ideas as to how to fix it.
So there's a lot of behind the scenes work that goes
that's
in.
happening. And so what they gave us were program ideas that we can now implement at the national level. So again, they do influence a lot of what we do. They might not be sitting at the higher tables all the time, but they do influence and drive the programmatic areas and how to reach them.
But we do have a rep at the table.
We have a youth rep at the table.
No, my other issue is, this is a serious national problem. But can I say that we're not taking it as a priority, even in terms of the way that we approach it? Let me give you an example. When I heard something like this, the buy-in from government, to my mind, should have been, listen, for all public servants, for National AIDS Testing Day, similar to when we have an election, you give half day off. one of the stations for testing has to be the 3 major national universities. You get extra credit if you want to go get your test done. There seems to not be the extra reach to be proactive, to be able to say, listen, this is something that important. This is as important as the election. This is as important as anything else you're doing. What more can we do in terms of supplementing National AIDS Testing Day to get people to realize that as government, as a public sector, and even as NGOs, this is...
But you can't mandate testing.
Right.
You can't, but you can put an enabling environment. For example, a simple thing like I said,
So like
half day off.
offering
PSU.
if you go test.
Even if you don't go test, it's on you, to me. But to create the opportunity, because voting is the same. You have the day off. If you don't go vote, that's up to you. But you cannot say, I didn't have the opportunity.
Right.
What more can we do in that light?
The thing is, from the Ministry of Health perspective, we actually we're going to universities to do education. For example, the University of Belize is working along with the Voluntary Counseling and Testing Center. They do tests there.
Yeah.
We go to all the high schools. But when it comes to health education at some of the institutions that are privately run, we have to limit our education.
Yeah.
So we advise, okay, so you
Yeah,
know
because
what?
they're uncomfortable with some of the talk.
Right,
And that's what I wanted to get at. I feel that we kind of just skirt around the issues when we talk HIV, and you know, it's almost frustrating because we know the realities here. Just as Eckert is able to tell us very clearly what young people are saying. Young people don't talk about, you know, barriers, or it doesn't matter whether they're working or not. If they want to know, they'll go. They'll go.
They do.
But there's a reason we don't. And I feel, I mean, I don't know how much we've explored into this topic, because we can talk about preventative, and I know it's hard, because even when you talk 19-90-90, those are 3 different courses of actions that take a whole lot of effort. One, the first 90, getting people tested. The only way 90% of people will know that they're positive is if we have more than at least 90 getting tested in the population.
Yeah.
Then you're talking about getting on treatment, which from those who do know, we're looking at half. Who are accessing free treatment, which will improve the quality of life. Almost in the most simple way of saying it, let them have a normal life versus what we expect people, or we perceive people to have HIV. Then 90% with suppressed virus, which is, and I know there's a very technical explanation to this, hopefully no doctor gets mad at me. It's almost like you don't have it. You do, but you know, you don't, it's almost like you don't have it. So those are 3 courses of action that you want to achieve in 2 years.
Yeah.
Yep. And then the demographics is also different.
Yeah. So my question is,
So
how are we going to achieve this?
Okay.
Which 90 do we tackle first?
so for now, because this is an initiative, something that the UN AIDS is achieving, right?
Yeah.
So for now, they have it at 2020, but
Yeah.
they already see that it's not going to be achievable. So it's already pushed up to 2030.
Okay.
All right. But for now, we're using the 2020, since this is what UN AIDS has at this point. But like you rightly mentioned, are we going to get there? Then I guess we have to push more, do more. And
I mean, I think it's great to have a goal in place. Don't get me wrong. We're still trying to end polio for years, but we're close. You know, and same thing with other diseases as well.
Right.
But my fundamental point is we got to start with an entry point. And is it that we're going to get the 1,000 who are on treatment to a suppressed viral load? Are we going to work on getting the 2,000 who we know their status on treatment? Or are we going to tackle the gargantuan task of getting 90% knowing their status?
yeah, well, to be honest with you, for the first time in 2016, we actually created a cascade with this 1990.
Okay.
Right?
Cascade?
Yeah.
What does that mean?
And it's where we estimate the the amount of persons living with HIV to take out, to extract this 90. So
Okay.
that's how we know that the 1,500 that are actually on treatment, and then from there we had a total of 507 that were virally suppressed.
Nice.
So that's how, because we do the viral load test in country. So that's how we actually know that from that 1,500 from the cascade that we had, that they actually have 507 virally suppressed. So for this year, Well, actually, we have a tool that could actually help us
Yeah.
to measure these targets. Right?
Can I ask about vulnerable populations? Currently, right now, they're the prison population.
Right.
It is a contained population, which risk is particularly high. And just to follow up the point that Melanie was making, which is that we're not having honest conversations about sex, and this is really, it starts
Right.
and ends
Yeah.
there.
Right.
Of course, there are other ways of contracting HIV, AIDS, but to me, the primary one
sexual.
Is risky behavior, unprotected sex?
Yeah.
is risky behavior. But it also extends to the populations because we're not being honest with our conversations. Because we're not saying that there's sexual activity happening in the prisons, and because we're not saying that there's drug usage in the prisons, and we're not saying that there's violence in the prisons, sexual violence in the prisons, then we don't consider them. How are we dealing with all the vulnerable populations in terms of getting them to the table here? Housewives, people who, for example, might be the LGBTI community, or prison population. How are we dealing with them?
Well, again, good question, and we do have an answer. As we speak, we're running a prison testing program.
Nice.
So as of yesterday and today. So that's a.
Guys
it's
came
a-
prepared?
It's a it's an initiative to hopefully get the entire prison population tested. We've started general pop, and then we have to go by their rules in terms of how they
Yeah.
promote the
Yeah.
people and so forth. But we're getting there, and we do beyond just the National AIDS Commission Secretariat. The partners of the commission test and engage the prison population throughout the year.
Yeah.
And we do have a pretty good relationship with the programmatically with the staff. In terms of the MSM LGBTI population, we're presently also as a part of National Testing Day, and it's something that Belize has been recognized for regionally in terms of our on-site testing program.
Yeah.
We are running programs through BFLA and Go Belize and Our Circle for the last week and a half, which deals specifically with these populations.
Yeah.
As we know, these organizations are in tune and they know exactly how and who to target. So we're running testing programs with these populations on a yearly basis. So programmatically we're reaching the demographic, and again it does feed into the ministry's data.
Yeah.
How about underage?
But I
With the
just want to
Wagner's
ask that. Can I?
facility. There's
Right,
also
Not just the ones who give
Education.
trouble, I'm talking about.
No, but and that's
If-
what I
if
was
it-
going to get at, because I think one of the things that we and you guys are humble because there's a lot of work that happens
Yes.
with HIV.
Right.
And so before we give the impression that you're not reaching out, we know
Right.
you go to construction sites,
Right.
you go to prison, you go to
Right.
schools, you
Right,
go to organizations like BTL, BEL, you work with male-dominated workforces.
Right.
So I don't want to leave that impression here. So, and I know obviously from you've spoken, you work with now LGBT populations, and there's even the outreach to sex workers as
Right.
well. But there are still vulnerable populations that are hard to reach, and I want you to tell me what those groups are, and why.
The vulnerable population.
What are the groups that we just can't tap into as yet to get tested or to get on treatment? Where are our weaknesses? Is it the underage population, like Kevin is suggesting?
Like the high schoolers and the.
Yeah.
You believe that they're not having sex? I got a
Right.
sweet bridge to sell you.
Right, that is difficult, as Mr. Coyoc alluded to. Different institutions will not allow certain conversations, and much less allow us in their institution. So that's a barrier. So what those kids do is, they will either get information from friends, internet, whatever. We try to lead to other organizations within their community that they can get information from. The high burden areas are Dangriga, San Ignacio, and Belize City. So we try to push most of our efforts there, not to forget the other districts, but at the same time, that's where the issue is. So in terms of
So
the
it's
underage
underage.
and stuff like that,
But there is a correct me if I'm wrong, there's a legal age that you can access services without your parents'
18.
Well,
18.
18. Wait. I have to be 18. Obviously, I passed it a long time. But if I were a 17-year-old, I can have sex,
Yeah.
but I can't go and get tested.
Right.
But by practice,
Right.
not by law.
What do you mean by practice?
In terms of the services, the attitude is usually that they would need parental consent
Yes.
to access the service at
Can't give
So-
below
service.
the age of 18.
I can make the decision to engage in unprotected sex at
At
16, 17, but I cannot make the responsible decision to go and get tested.
Yes.
You're a minor.
can,
So,
You have to get the-
But-
you have to
I have
get
a
the
minor
parent.
at 16
might-
to decide whether or not I'm having sex, but I can choose who my partner will be, but not who I'll vote for. That's a whole other conversation. What are we doing from the governmental level to kind of get, because this is where sometimes these little gaps, they really
Right.
can be an area where you foster more problems.
It could be done, consented by meaning the parent accompanies the individual, the youth.
Or an adult.
But the good thing about it is that the parent would be excluded from doing from the test while all the counseling is happening. So whatever the individual would say to the counselor would be just on with both of them.
You
So
know,
the
I can
parent
see
won't be
that. I
involved.
can see that happening maybe with a male, and I'm being honest here, because I have parents of males who are cognizant of early sexual behavior. But listen, if I'm a 16-year-old girl, there is no way I'm asking mom or dad to take me to go and get an HIV test.
but you have the
no
option.
way.
You have
Consideration
the,
of other things too.
Right.
Yeah.
It's saying I'm
Yeah.
having sex, and I probably am.
but you have institutions that would provide that service, like BFLA.
Yeah.
So at age 16, you
Yeah.
could still get the
So
contraceptives
BFLA
you need,
will
as well as
give
the
you
testing.
all the reproductive health services at 16.
Yeah.
Great for them. But we do have to fix that
Yeah.
gap,
Yeah, that's,
Yeah.
that's one of what we've been working on.
Working on to
I imagine. But let's get, Kevin, go ahead, let me hear.
still
No,
a fuzzy.
I wanted to get into the nut. I'm curious about the nuts and bolts. How is this going to roll out National AIDS Testing Day? Where is it going to be happening? What do I need to bring? What do I need to do? Follow up afterwards.
Okay,
Give me the
so-
nuts and bolts logistics.
Right, so we have, well, we can pull up the map. We have
Yeah,
8 sites nationwide.
think we gave
So
it to
we'll
them.
have San Pedro at the Polyclinic, Corozal also at the Polyclinic, Orange Walk at the Central Park, Belize City at Battlefield Park, Bemopan at Crossland Police Station,
Yeah.
right? San Ignacio at the Welcome Center, Dangriga at Courts Parking Lot, and PG at the Central Park.
Arthur, does it matter where this testing occurs? Are people more comfortable at the Polytechnic Clinic as opposed to being in the Central Park, or would they like build more as compared to, you know, does where the testing happen matter?
Well, what we try to do is we do have our partners in each of these districts and sites that we coordinate with on a regular basis. So we look at their local decision to say, look, these are the places that the people feel comfortable with,
Yeah.
within these districts. Our general concept is find a central location that has high traffic and that you can capture the most people. For those who don't normally go to the clinics or who don't want to go to clinics, they can say, well, I'm passing the park on my way to work, I want to take my test.
Is it normally successful? You usually have good traffic for testing day?
Yeah.
Right. So we do have our peak times, which usually correspond with lunchtime. So you'd have anywhere between 11 and 1:30. You'd have your peak time. But we do have people coming in from the onset, from 9 straight through to 3. You'd have people coming in,
Okay.
and we do have incentives to give away at each of these sites, based on our partnership with Digicel and other organizations. We are giving away phone cards.
Nice.
And things like that, keychains after getting tested, that kind of thing. So the
And there are lots of other
incentives,
health fair
but-
booths.
right?
stuff
There
as
are
well.
booths, right? So you have other partners, DYS, BFLA, all of them will be out there to give away stuff and engage. In Belize City, we also have fine arts artists out there painting.
Nice.
So we did this already World AIDS Day, and it came across really well. So we're repeating the program, but the incentives are not payment for you to come
Yeah.
and get tested.
Yeah.
They're only there for a period of time,
Yeah.
right? And it's just to
It's
say
just
we
what your
appreciate that
sponsors
you're
are
giving
giving.
your time. It is a personal thing, and we want to alleviate some of that kind of apprehension.
We're missing one of the most important facts in this
What's that?
conversation, right? So for all the people who are scared of needles, there's a new
Oh, right.
test
Every
now.
year.
Yeah. You know how many people tell me they don't get tested because they don't like needles? Especially men.
Can you explain it?
Yeah.
Especially
I think that
men.
we had a
Yeah.
slide.
All right.
So now it's the finger prick,
Yeah,
right?
the finger
Right.
prick.
Yeah.
Right.
It's a finger prick.
Smaller needle.
It's like a glucose.
Like a glucose test, like when
It's a needle.
yeah.
Just a smaller one.
Men are afraid of needles. Well, us men are.
Yeah.
No, it takes approximately it takes 15 minutes to do the entire process. It's a finger prick. The blood sample is extracted and put and applied on the strip,
Yeah.
and it runs for like in 5 minutes. But by the time we do the pre-counseling, the intra and the post-counseling, it takes approximately 15 minutes.
That's all
get
of your
result.
time
Yes.
That's awesome.
to
Yeah.
know
Yeah.
your status. How often should we be tested?
At least twice a year.
Twice a year, at least.
Twice a
at least
year.
Twice a year. If you're at a high risk, if you know you're at a high risk behavior and practice, we recommend every 3 months.
What's high risk behavior?
Meaning you're having unprotected sex,
Multiple yeah.
partners, etc.
Okay. Drug use?
Drug use,
Yeah.
right, stuff like that.
This let me just add this test that we have here. We have 2 tests that we do. We have what we call the Determine, which is a strip that we utilize, and this is a new test that we started to use as of October last year. It's called the standard diagnostic test. It tests for HIV virus 1 and 2, so it could tell you which of the virus strains you have. As you can
That's
see, I don't know if you could see the one,
Yeah.
and then so this is positive for the strain 1.
Wow.
Right? Usually
That's good for treatment, right?
Yes.
Yeah.
So thanks. So in the
You guys are good though. Right?
in the like in Europe, Africa, and those other countries, you would find both strains because out there the strains are already. It's been a while out there.
What
But
do we typically have in Belize?
One.
Okay.
So this is a secondary test. So we do this on all positive persons that are positive with the Determine. We do this secondary test. So this is like a parallel test that we do.
Yeah.
So once both of these tests comes out reactive, automatically we could consider the person being positive.
And hopefully get them on treatment.
Yes.
Can I ask my final question, which is, to me, dealing with HIV and AIDS, we'll never change or we'll never cure it until first we start off with honest conversations. But after we are somehow able to do that, which is near impossible, we have to make it cool and normal for people to know what their health is. And when I say cool, I mean there have been previous programs which I think were extremely successful, like when you had the barbers who were
Right.
participating.
Yeah.
But as a communication thing, Arthur, how can we move it into that realm where it's normal, where it's no different from driving past a gas station and seeing somebody putting in gas, or it's no different from seeing Tanya Carter sing a song on stage. It's that cool, or a DJ spinning music. How do we get it to the realm of cool and normal in Belize to get over this fear? Because I don't think we'll reach until we win that battle.
I think it's a multiple layer issue, as we spoke about earlier in terms of the generation moving and understanding sexuality and talk about these things before more openly. We did engage with DJs, barbers, so we've run multiple programs and that went
Couple of public figures.
couple of public figures, right? So we had Miss Belize one spell and all these things. So we're getting to that level, but it take time. It will take time
We
because,
have
as
the
I said,
time.
it's behavior change.
Do we have the time?
It'll take the generation, the younger
Right.
generation that
Younger
will push
generation,
the
yeah.
change.
Yeah.
Because discrimination is still
Yeah.
the reason why
Right.
a lot of people
That's
are
right.
reacting
Stigma and
to that way.
discrimination.
Yeah.
Can I just close off with this? So to do the test, it's easy, it's highly accurate, it's private. The results is in 15 minutes, and most important, it's free.
Yeah.
Free of cost.
Right.
All right, so June 29th,
29th.
which is this Friday,
Yep.
there is a location in every district. You can go out 9 a.m. till 3 p.m. There are other booths on display, other things you can engage in. And please, if you're not free on Friday, the clinics do it for free as well on any other
Yeah,
given
yeah,
day.
yeah.
So it make no excuse about knowing your status.
Right.
Thank you, gentlemen, for coming in, and
Thank
best
you for
of
having
luck.
us.
Thank you.
We're going to go ahead and take a break, and when we come back, we'll be talking about a police basketball tournament. So stay tuned.